Hi, my name is Steve Kilburn. I am the Grant Projects Director at the Chautauqua County Department of Mental Hygiene. And I lead what we have called the Chautauqua Substance Abuse Response Partnership. This is a collaborative effort of prevention, treatment, recovery, and harm reduction agencies, all right here in our county and across our county, working together to combat addiction in Chautauqua County. We are, all of us, in the midst of a pandemic right now, and a lot of changes have been taking place as a result. One of the things that we've wanted to do in light of those changes is a series of videos so that we can communicate to the public and to folks who are interested and perhaps seeking services or support during this time about what our member agencies are doing and what services are still being provided, and there are services still being provided. We want to give opportunity today for the Mental Health Association to talk about their work, and so I am very pleased to have their Executive Director, Stephen Cobb, join us for today's video. Hi, Stephen.
Hey, Steve, how are you?
I'm doing well, hanging in there. You?
Good. Yeah, likewise, I'm hanging in there too. Learning how to social distance and at the same time stay connected.
It's a challenge, isn't it?
It's a challenge. And
tell us your role and at the Mental Health Association, and for those who wouldn't be familiar with it, what is the Mental Health Association?
Sure. The Mental Health Association in Chautauqua County is a peer-based recovery organization. And we have two recovery centers in Chautauqua County, one in Jamestown and one in Dunkirk, although right now we have temporarily suspended the operation of our Dunkirk facility, and we're serving that community, all of the communities through phone, but right now we just have our Jamestown facility open. And the thing that's kind of unique about the Mental Health Association is that we're a peer-run organization, and everyone who works at the Mental Health Association has lived recovery experiences. So when we say recovery experiences, we mean both in the dimension of a substance use disorder and also mental illness or wellness, mental wellness. And we base, and the foundational part of the work we do is from that lived experience. We work with people who identify as being in recovery, or and the families of people, or loved ones of people who are in recovery, because the recovery process doesn't just involve the person who has the diagnosis, it also needs the support of the whole family and a change in the family dynamic often too.
Yeah, certainly. Well, I have been familiar with the Mental Health Association for, I don't know how many years, but with this grant at the Department of Mental Hygiene, I have become even more familiar with it and more impressed the more I get to know what this agency does and the contribution that it makes to our communities.
Thanks. I've been working here at the Mental Health Association for 9 years, and when I first started working here, there were 3 employees. I was the third full-time employee to come on, and at the first of the year, we had 20 full-time employees here. So we've grown enormously, and with that growth, we're able to really meet people where they're at. So although we do have a recovery center here, we're actually able to get out in the community too and meet people where they're at, whether that's in a clinic, if they're getting services in a clinical setting, or at the hospital, or at their home, if it's easier for us to get to them instead of them getting to us, and helping people with all those different components of recovery, not just getting better, but once you do get better, if you have to return to work, how can we support you while you return to work? How can we help you heal your family unit if that was affected? So we really have the ability to get out in the community and really meet people where they're at. And that's exciting.
Very. And it's, of course, one of the things I've become so impressed with the work of the Mental Health Association. So what are some of the particulars in terms of programs, et cetera, that are provided through the Mental Health Association?
Sure. We do, I think two of our foundational things are recovery coaching, which is a process where one of our peers gets connected with somebody who's in recovery, and the peer and the recovery, as we call them, begin to build a working relationship, and out of that relationship comes a recovery plan. So we actually work with the people to set up goals that they'd like to achieve in their recovery. So that could be as something as foundational as someone with a substance use disorder not using anymore or cutting down on use. And then it can go all the way up to helping them return to work, or help them straighten out legal issues, or get connected with a primary care physician, whatever those identified goals are with the participant. And then one of the other things we do is peer support groups. So we were doing, prior to the pandemic hitting, between Jamestown and Dunkirk, we were doing probably, I think we were right around 42 different weekly peer support groups between Dunkirk and Jamestown. And we had, I think we had about 10% of those groups were in Spanish too. So we were offering services in both English and Spanish, as we do with our recovery coaching. So those are kind of the first things we started doing. But as we've grown, we have partnerships with the different clinics here in Chautauqua County. And I'm really excited about this part is we actually have peers in the emergency room, so that should somebody present to the emergency room experiencing overdose or requesting withdrawal supports, we're actually able to now, and this is maybe good things come out of pandemic, but we've actually been able to work really closely with UPMC to get people in and out of the emergency room. And we're down to about an hour and a half, 2 hours now, and they leave the emergency room connected with the supports, the clinical supports, the peer supports, and the medication they might need. And we're actually able to make sure they get that medication and get back to their home. And that's a huge step forward for our community, where there is a perception that it is hard to get connected with MAT if you have an opioid use disorder. And that's not always the case, and we're really happy about that.
Well, in each of those cases, and I know there are any number of other programs as well that take place through the Mental Health Association, but whether we're talking about the linking folks with medication-assisted treatment, or MAT, whether we're talking about reaching out to folks following an overdose, or giving support and help to get folks who are in recovery back into the workforce. We could recount, you especially could recount specific and many specific instances of specific people for whom these services have actually been, in some cases, life-saving, in other cases, life-encouraging and strengthening. So we do want to get that message out that those services are available. And it's probably worth saying that, pick your time frames, but if you were to turn the clock back X number of years, some things were different.
Yeah.
And they're better now in terms of access to services.
Yeah.
And so whatever experiences somebody might have had or have heard others having had, we would want to urge them not to allow that to get in the way of seeking what they might need today.
Right. And I can't echo that enough, Steve. I think that it might be logical to assume that during a pandemic, it's harder to get connected with services for treatment. And I don't know that I would say it's harder. I think it's just a different way to get connected with services. And I actually think that as a county, we've come a long ways in making those services a lot more accessible. And even now, during a pandemic, I still think they're accessible. It's very easy to reach out to any of our treatment facilities through phone. And if you're having any difficulties with that, one of the things our peer coaches can do is they can be wonderful navigators to help people get connected with treatment. So the peer recovery supports that we provide are one type of service to support somebody in recovery, but that treatment component is just essential also. And our peers are very versed at helping people if they don't have insurance, for instance. That should not be a reason for you to not try to get or to not get connected to treatment. In most instances, within 2 to 3 days, we can get some type of insurance in place for people so they can have some type of treatment. Yes. So it's there's a lot of barriers that we can help remove, but the process itself has gotten a lot more streamlined.
So if somebody, maybe watching this or, telling somebody else about the services of the Mental Health Association, what would they do now if somebody wanted to reach out and get the support and help that you guys offer?
Yeah. So I think the best way to reach us now is just through phone or a text message if you're more comfortable texting. Our number is 716-661-9044. And that number works both as a voice line and as a text line. So we're able to receive both types of communication at the same time. And we have peers manning our phone from 8 in the morning until 12 midnight, 7 days a week. So with the actual closing of our center and to be mindful of the pandemic and knowing that this is a stressful time for people, we wanted to make sure that our peers were available to people. So we've kind of expanded the phone hours. So now you can reach out until 12 midnight at our number 661-9044 and get connected with a peer. You can also reach us on Facebook. And if you go to our Facebook page, which is MHA in Chautauqua County, you can direct message us through Facebook also. With the closing of our 2 recovery centers, we've actually shifted all of our peer support groups to online. If you actually go to our website, which is mhachautauqua.org, you can get the directions right there to connect with the groups. We have a group 7 days a week. We have one group at 10 a.m., 2 p.m., and 7 p.m. at night. But our full schedule is on our website at mhachautauqua.org. All of our services at the MHA are free. So you don't need an insurance card to reach out to us. It's not something you're going to have to pay out of pocket. A lot of times we support people by just, a couple phone conversations for a few weeks. And that's all people need is that little additional support to get through a difficult time. And it's not a sign of weakness to reach out and ask for that help. It's actually a sign of good self-care and awareness of what you need as a person. And we should all be listening to that at times like this.
Yes, very, very well said. Yep, thank you. Well, we like to ask on these videos, just how are you doing? This is as we hear time and again, this is an unprecedented season in all of our lives. How are you doing, Stephen?
At the beginning of our little interview here, I talked about a peer as someone with lived experiences, and I said that everyone who worked here has lived experiences. So if you caught that and put 2 and 2 together, that means I have lived recovery experiences. And one of the things I found out from my own recovery that the opposite of addiction for me was being connected and being part of a community. While abstinence was certainly a part of that path, the thing that really supported me in recovery was connection and being part of a community. And we're in a period of time where we're not supposed to physically connect, and for someone like me, that leaves us to figure out how do you connect in other ways. And so that's been a challenge for me that I think I've grown through, and so it's even at an awful time, I guess I'm in a time that makes me uncomfortable. It's also a time where I feel like I'm learning new things and growing. So I guess I I guess I would encourage anyone who's listening to this who is in anyone, not just somebody who's in recovery, but to learn and stretch and figure out how you stay connected to people during a time where, for health reasons, we're being asked to physically stay apart.
Well, I want to give special thanks to Stephen Cobb, the Executive Director of the Mental Health Association. The Mental Health Association is a partner and member of the Chautauqua Substance Abuse Response Partnership, working together to combat addiction in Chautauqua County. Thanks, folks, for watching, and stay well.